My passion about dentistry goes way back. When I was in high school, actually. My mom was getting her dental treatment, and she always needed dentistry. She was in dental offices all the time. And I realized how her dentist interacts with her, and the fact that it was a profession that provides care to people and changes their lives. And when I was in dental school, I realized that, even though each and every specialty has its impact on the quality of life, I think the prosthodontics has the biggest impact. And prosthodontics led me to implant dentistry because there are so many different ways of replacing missing teeth. They lose their teeth, they're about to lose their teeth, or they have no teeth. You can place an implant and replace their teeth within a day. I said I should provide that to my patients. When the patient comes in, we don't see that as just somebody coming in looking for a dental care. We look at them as a friend, sister, brother, and when we treat them like that, they see it, they realize that we truly care. I decided to put everything under one roof so that, there's ease of communication, everything is streamlined, and everything is over-engineered. And everybody knows what we're aiming and what we're targeting. I structured my practice and the laboratory and the surgical center all together, that they work together as a team towards the success of the treatment and the satisfaction of the patient. The design of superior materials and the prosthetics, it requires the laboratory to be on board. So I have the laboratory and laboratory technicians who know exactly what I want and what the design is, what the plan is, what the treatment plan is, which makes the treatment a whole lot easier, faster, much more affordable. So the most joy that I get when a treatment is complete is when the patient comes back. And especially if they tell me that, oh doctor, just because of my confidence, I got a new job. I have a girlfriend now or a boyfriend now. That is the impact that you have in their life. It's not, giving teeth or, now they can eat almonds, peanuts, or corn on the cob. But now they feel better. Their life changed significantly. And that gives me joy and satisfaction. And if you would like to change your life, gain your confidence back, give us a chance. Give us a call here at In a Day Smile Dental Implant Centers. We'll be happy to provide the best care for you. So I've been doing this for about 25 years, and throughout my career, I've seen everything, like good, bad, and ugly. We get patients from all across the board, not only from Florida, from out of state as well. International patients come to us to get failing implants or failing implant treatments treated again. So essentially, the lack of experience and lack of proper training leads to all these causes and failure of the treatment. When the patient decides that they want to receive this treatment, first thing they need to look at, who is the doctor? How many cases has he done? What kind of training he received? What are his credentials? And also the training is very important too. Is this practice geared towards this treatment? Some dentists, they like to do a little bit of this and a little bit of that and a little bit of this. That doesn't mean that they're not going to do a great job. But I think if a doctor that does solely this type of treatment, their practice is more streamlined. And it's not only them, also it's their team too. The team would know how to address a complication or how to address a problem if it rises. So if you're interested in learning more about us and how many cases we've done, what kind of training I received, or if you would like to see the cases that I've done, please feel free to call us. And you can come and meet my amazing team, receive a complimentary exam and consultation, and talk to you about your expectations and your needs and how I can help you start your journey to an amazing smile. So patients ask me often why they should get dental implants, especially the patients who are using dentures. majority of the patients who come to us, their expectation is they'd like to go back to their life without having to think about their teeth. And they want to eat apples, corn on the cob, or they want to eat almonds and peanuts and without having to worry about their teeth coming out. Even though a complete denture replaces your missing teeth and an implant supported porcelain teeth replaces your missing teeth, in aesthetics, function, longevity, there are major differences because the quality of life is very different. In addition to that, if you receive a denture, what's going to happen is over time you're going to get bone resorption. Their bone quantity and the quality goes down, and it's aging plus the effect of denture. That makes it tougher down the road to put implants and get a fixed prosthesis, and that's why patients seek us. So if you would like to learn more about dental implants, please feel free to call us at In a Day Smile Dental Implant Centers. We'll be happy to give you a complimentary exam so you're well informed, and then we can move forward with your happy smile. Dentistry evolved so much within the last 20-25 years that most things that we used to do, we don't have to do it anymore because of digital dentistry. The impressions we take digitally, the prostheses, their teeth are designed on computers, frameworks are designed on the computers, made by CAD/CAM machines. And now the dentists can have their own laboratories in-house. It's a digital laboratory. If they can have all the equipment and all the gear, and then they can design their own prosthesis in-house. That helps you increase the flow, the accuracy of the prosthesis, and finish the treatment faster than what it used to be. Digital dentistry has a big impact in dentistry. One other important factor, it reduces the cost of the treatment. If you have a lot of labor completing that treatment, then it's going to be expensive. But if you use digital dentistry, computerized, then it's going to be accurate and less expensive. And if you're interested in learning more about our laboratory or our technology, please feel free to call us here at In a Day Smile, and we'll be happy to tell you more about the benefits of digital dentistry and how it can help you getting more accurate prosthesis, more accurate implants, and a successful treatment with longevity.
In any business, a good smile is a good start. Also, when you sell art and design, that is what loosens up the situation. It creates the rapport and possibly a deal. So in that way, it really bothered me that my teeth were not very presentable. There were quite a few problems due to periods of neglect in my youth and maybe smoking, but whatever. I had a very dear friend who was my regular dentist, and he saved them for many years. But there came a time when we could not find abutments for new bridges, and this one fell out, and I got a flipper in. They were not functional anymore. It took up a lot of my day and maybe my mood too, that I had pains and infections all the time. So I knew something had to be done. And then I went to Dr. Burak. In the first conversation, he said, I think, and then he said, I know that you'll be happy with it. And that sort of confidence, that can be pretty inspiring.
Lars knew that his teeth were terminal, and he felt so embarrassed of his smile. He couldn't even talk. He had to close his mouth when he was talking. So I sat down and talked to him, and the fact that he was referred to me by a friend of mine, by another dentist friend of mine, made things easier because he knows him and he knows that his friend, our common friend, trusts me. So he trusted me.
He presented all the options, from the cheapest option to the most high-tech option, and which was the best, and that was the one I wanted.
His treatment was very easygoing, even though it's a complex treatment. He did not have any complications.
It was amazing to have all these services, and even the complicated ones, under one roof. I mean, the initial surgery involved 16 tooth extractions and 12 implants in one day. And the way it was handled, the careful way I was sedated, made it a piece of cake.
His temperatures came out great. Surgery went really well. Lars, though, he did, unlike my other patients, he said, on my final teeth, I want imperfections. I do not want perfectly aligned teeth. I want them to look natural. So we gave him uneven teeth, look like as natural as it looks. And he said, oh my God, that's exactly what I wanted. They still look beautiful, but they look very natural. So even people who know Lars call me and tell me that, what did you do to Lars? He's changed completely. So it's a life-changing experience. It changes the quality of life.
In my gallery, and we had a lot of people working there, it was noticed that I smiled. They used to call me the silent Dane. I'm from Denmark. But they don't say that anymore, because I'm just more inspired to talk.
Seeing another patient, transform this way, gives me pleasure. It makes me happy too. Why do dental implants fail? It's a common question that is asked by patients. There are several reasons to it. Ideally, a dental implant restoration should last as long as the patient lasts. But I believe the primary factor is poorly fabricated prosthesis, poorly placed implants, unhygienic prosthesis, and then after that, systemic diseases and the lifestyle, like smoking. Are these all preventable? I believe they are preventable. How they can be prevented? One, I think receiving the treatment from a well-trained dentist, well-experienced dentist is the number one factor. Number two, home care. Number three, maintenance by your dentist. If you go and see your dentist every 3-4 months, before the problems rise, he can address those. So if you're interested in learning more, or if you think that you have a failing or ailing implant or implant restoration, please feel free to call us. We'll take a cone beam CT scan for you and your x-rays complimentary, and we'll let you know what the problem is and what we can do for you. So there are about 12 different specialties in dentistry. The ones that focus on implants and implant dentistry, there are about 3. Oral surgeons who place implants, and periodontists, again, who places implants or who treat failing implants if there's an infection, inflammation underneath the gum line, then it's a periodontist, and prosthodontists. Though general dentists do implants, place and restore implants as well. The ultimate goal is to replace your missing teeth. And the specialty that focuses on replacing missing teeth and the function and aesthetics is prosthodontics, because they have the training, structured training, and they have the credentials to provide this treatment. So if you're interested in getting implant supported prosthesis, please give us a call here at In-A-Day Smile Dental Implant Centers. I'll be happy to talk to you about my background, my training, my specialty, and let you know how I can change your smile and improve your quality of life. Dentists offer their patients who are looking to get a fixed prosthesis, so all-on-4, because it became a boilerplate treatment for terminal dentition or complete edentulism, complete missing teeth. And I disagree with that approach. I believe if a patient comes and there's enough bone structure, we should put more than 4 implants. I prefer to put 6 implants. And if I have 6 implants, then fabricate a porcelain fused to titanium prosthesis, which lasts longer, much easily cleanable, much more hygienic, and it's better function. By over-engineering the design of the prosthesis and increasing the number of implants that I can place, I'm confident that I can achieve longevity. And I tell that to the patient. I tell them that you have lifetime warranty. If anything happens, rest assured, come back, your prosthesis will be replaced or repaired free of charge, no cost to you. So when the patients leave, they are comfortable and they know that they have a prosthesis that is going to last. So if you're interested in learning more about our prosthetic designs, the materials that we use, and how many implants you can get, please feel free to call us here at In a Day Smile Dental Implant Centers, and we'll be happy to give you a complimentary exam so you're well informed and you can move forward towards your beautiful smile that's going to last for the rest of your life.
When I was in the 2nd grade, I fell on the cement and I knocked out my front teeth. At the time, dentistry wasn't like it is today, and so they actually took those teeth that got knocked out and put them back in. Subsequently, they ended up infecting, I guess, or causing periodontal disease. My teeth progressively got worse. I maintained them, but at the time, raising a family, I didn't think I could afford implants. So I wore a denture for a really long time, too long. Eventually the bone deteriorated so much that they just kept having to fix the denture, but I also hated wearing a denture. So finally my periodontist he worked closely with Dr. Taskonak.
So Dawn came to us about 3 years ago. That denture thing really was on the top of her mind all the time. She wanted to gain her confidence back, not only getting the function back, and the quality of life. And the fact that she has been on dentures for 30 years, didn't make it a whole lot easier because she lost a lot of bone during that period of time.
I believe it took 3 bone grafts to get enough bone in my upper. Not only that, but it eliminated the wrinkles right there.
And then we put her implants in, we put a temporary on, and then she finally got porcelain teeth. And from that point on, she bloomed.
When I saw my smile for the first time, it was great. I couldn't stop looking at myself in the mirror. So I always had a good smile, but when I saw how natural my teeth looked and how pretty they are.
She bloomed. She was very bubbly, outgoing, and talkative. She talks to everybody. She's friends with everybody, and she's full of life. Giving those treatments is really satisfying when you see patients transform in that way.
I love Dr. Taskonak. Every time I come in here, he's warm, he's comforting, to the point where the night I had my one of my surgeries, his wife had delivered twins, and he came in that next day to make sure I was okay. Who does that? Dr. Taskonak's the best.